Hello everyone. Welcome to Lify Life, Tick season, safety rules and actions in case of a bite. Picnic and tick season is in full swing. So that outdoor recreation does not end with an insect bite, you need to protect yourself and your children. Safety regulations. Ticks are carriers and causative agents of Lyme disease and tick-borne encephalitis. Tick-borne encephalitis destroys the central and peripheral nervous systems, leading to limb paralysis. In some cases, to death. Lyme disease is less dangerous, but if left untreated, it can disrupt the functioning of the heart, liver, and joints. Carriers of infections are about 20 to 30% of insects. Infection occurs after the bite of a tick that has been infected with encephalitis virus or Borrelia bacteria, but not always. But since there is a risk and it is rather big, going on a picnic. 1. Put on close-fitting light-colored clothing, a long-sleeve sweater, high socks, pants that are tapered to the bottom. It is easier to see ticks on light-colored clothes than on dark ones. And if it is fitted, it is more difficult for the insect to find a place to bite and stick to the skin. Examine yourself and children every 1.52 hours. 2. Put on hats to protect your scalp from tick bites. 3. Treat clothing with an aerosol against ticks, apply cream to the skin. For children, use only children's protective equipment. 4. Clear place for a picnic, remove dry branches, leaves, mowed grass. Do not sit in tall grass, in the shade of low bushes, because that is where ticks live, and not on trees. Watch where children play. 5. Put iodine, chlorhexidine or hydrogen peroxide, thread, tweezers or tongs to remove ticks in your first aid kit. Forceps are an inexpensive reusable tool. After a tick bite, I recommend seeking medical attention. But, if you are far from the city, you will have to remove the tick yourself. The longer it is in the skin, the higher the risk of infection. The tick releases saliva into the blood. 6. Upon returning home, inspect clothing, bags, beds, and each other for ticks. Pay attention to the abdomen, groin, navel, neck, folds under the breasts, skin behind the ears, popliteal foci. These are favorite places for ticks. Wash clothes, bags, blankets. Actions for a tick bite. If you find a tick on yourself, don't panic. Calm down and ask your family for help. If a tick has bitten a child, try to remove the tick in a playful way, without focusing on the danger. 1. Seek medical attention within 72 hours of being bitten. Or, if possible, remove the insect from the skin yourself with tweezers, tongs or thread. The main thing is to get the whole insect. Do not lubricate the bite site with gasoline, sunflower oil, greasy hand cream. The tick will clog the spiracles, and it will involuntarily release saliva into the blood. The risk of infection is increased. 2. Treat the bite site with iodine and cover with a breathable patch. 3. Place the tick in a clean, airtight container with a small piece of damp cotton wool. And take it to a lab to be tested for Lyme disease or tick-borne encephalitis. During pregnancy, this must be done. 4. On the 21st day after the bite, take an analysis for the presence of Borrelia bacteria in the body. They provoke the development of Lyme disease. 5. For a month, monitor your well-being. Fever, chills, headache or muscle pain, the appearance of a red spot with a pale cinder at the site of the bite may signal an infection. If you have these symptoms, see your doctor immediately. In some cases, characteristic symptoms appear later than 30 days after the bite. Prophylactic antibiotics begin 1-3 days, within 72 hours, after a tick bite is prescribed by a doctor. Later, medication is not justified, as is the unauthorized use of antibiotics. I also advise you to mow and clean the grass regularly if you live in a private house. Ticks are active from March to November. Peaks of insect activity occur in April to May and August to September. In order not to be afraid of meeting ticks, I advise you to get vaccinated. The tick-borne encephalitis vaccine is the only reliable method of protection. The effectiveness of vaccination is 95%. No cream or aerosol will provide you with such a percentage of protection. Immunity to tick-borne encephalitis develops within 2-3 weeks. Revaccination is carried out every 3 years. During the tick season, emergency vaccination may be used. 2 doses of the vaccine are administered 2 weeks apart. Standard, with an interval of 1 3 months or 1 7 months, depending on the vaccine. Both vaccination schedules are safe for both children and adults. Children are vaccinated from 6-12 months of age, as they are prone to a more severe course of tick-borne encephalitis in case of infection. All good health. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Hope seeing you back on Lify Life.